My name is Agyei Wiafe, and I'm a clinical psychologist. I am the founder for Rare Disease Ghana Initiative, which is the National Nonprofit Alliance for Undiagnosed Genetic and Rare Diseases in Ghana. And it's made up of a network of clinicians, researchers, and patients, and patient advocacy organizations. My interest in rare diseases started when I met family living with an undiagnosed disease. And so when I met them was their fourth child, and their fourth child had a gross developmental delay, had been brought to the hospital. And from the history, I got to know they have other children who were equally affected. Well, we're fortunately able to do some MRI for them, where the MRI came out that they had a poencephaly cyst. And it was through my reading that I came across knowing more about rare diseases and knowing that conditions like that have genetic factors. And I begin to question why we do not have programs, we don't have systems, we don't have laws, we don't have regulation. Generally, access to healthcare for complex medical condition is a huge challenge. We can talk about basic common conditions such as hypertension, stroke, diabetes. And so living with a rare disease, it's a double burden because the country is already battling with high incidence and a burden of infectious diseases. Usually, the resources are usually constrained, and so the non-communicable diseases in general do not have the needed investments that it ought to get. And so having a rare disease, it becomes very, very challenging because even in the non-communicable disease sector too, governments are also left with no other option than to prioritize. We are mostly training the area of either how to manage infectious diseases and some common non-communicable diseases. And usually there is not emphasis on in how to deal with conditions which may have genetic origins, such as most rare diseases. Also in access to diagnosis, there isn't many laboratories who are running genetic services or diagnostic services for rare diseases. And so even though a clinician may suspect a rare disease, there isn't much they can do in terms of confirming the diagnosis. And so they try to manage the patient as and when the symptoms get worse or symptomatical, even though there may be some additional help they could provide if they know exactly what they are dealing with. Generally, most patients living with rare diseases globally do not have access to treatment. But specifically for Ghana, and I believe it may be very similar to most developing countries, that the few available treatments are difficult to access. We've been fortunate that through advocacy and through awareness, the FDA has currently published the new guideline for registration of orphan drugs in Ghana. And that is very encouraging and very positive. Aside that, we had the regulation for expanded access for named patient programs. But generally, having access, you can't be able to buy or procure rare disease drugs on the market. Introduction of Rare Disease Ghana initiative since 2017, we've made efforts in being able to bridge these gaps in our own small way. One of the ways is to be able to increase awareness. So we started with the celebration of the Rare Disease Day. We are also into medical trainings through symposiums and through workshops and specialized trainings. And throughout with some of our partners, we have trained clinicians usually in the area of inborn errors of metabolism and some metabolic disorders, and we are hoping to expand it moving forward. We have also been able to, in the area of diagnostics, we've entered into some partnerships with some laboratories, and so we are also making headway with the diagnosis, and we are hoping that through our work we'll be able to, in the future, be able to diagnose locally where the capacity is, when we have the capacity.